So, how important is it to have a treatment plan for MDS and why?
Well, it's very important to have an individualized plan, and the number of parameters that play into that are increasing all the time. So we have the patient's symptoms and establishing a plan for relieving those symptoms as much as possible. We want to establish what the goals of treatment are right from the start. So most of the plan is related to the goals of treatment. What are we trying to improve? In what way can we make the patient's life better or at least acceptable? And so the treatment plan is based upon the goals. But the factors that play into the treatment plan are the nature of the disease that they have, the very specific type of MDS that they have, and we're learning more and more about that all the time. Then there are the other diseases that affect the patient at the same time, and we're not so studied. Those are not so studied, but they are clearly major players in how we would approach the specific treatment and what the patient's expectations might be of the treatment. And then there are the treatments themselves and whether they are suitable for an individual patient, whether perhaps they might be too toxic under some circumstances, or they might be just simply not effective in that particular specific situation, whereas in other patients with MDS they might be effective. So we try to come up with a plan that's based upon a synthesis of all of that information, and we document that carefully then in letters, and we send the patient the copy of the letter that we send to the GP. And this is now becoming much more standard practice in the NHS generally. And that allows the patient to have a verbal understanding, them and their family, of what was discussed, and then hopefully a written document that they can use to reinforce that information.